Good morning. Welcome to FRCmedia. I'm Keith Tebow. It is Thursday, April 16th, 2020, and I'd like to join all of you watching us on Facebook right now, as well as on Channel 95, as we continue our coverage of talking with people and how we're all dealing with the COVID-19 pandemic. This time of the week has been our schedule, where we check in with the mayor of the city of Fall River. Pleased to bring in Mayor Paul Coogan. Mayor, how are you?
Good. How are you, Keith?
We're doing well. This has been one of the more difficult weeks, I believe, for the city in terms of dealing with the pandemic. In terms of number of cases, we're over 160. We saw some days that had big spikes, some not as much. And unfortunately, yesterday, Mayor, we had to report that we had the first fatality here in Fall River.
Yeah, that's probably the worst kick in the teeth we've had all week. We were extremely blessed for a while and moving along without them. But again, and then, there's people out there that say we've had this, we've had that, but they have to understand that if someone dies at Charlton, that doesn't mean they're from Fall River. That's a regional hospital. And we have obviously patients in there from all over Bristol County. The way the Board of Health regulates both the cases and, regretfully, the fatalities is where they live. And we had our first one yesterday. I was down at the Board of Health this morning. Obviously, we have some people that are in different degrees of distress, and we can only hope. But right now, that's the one we do have. When I check on the residents of Fall River, I go to the city clerk and I go to the Board of Health. Those are the ones that have the documentation and the statistics. It's not going to be. I'm not going to get my information about something that serious off of Facebook or off of a rumor. We're going to follow through and make sure we do it the right way to the best of our ability.
One of the things that was some good news this week is the city has started reporting those that have been cleared of the virus. I believe we're over 30, almost 40 as of the last report that was issued by the city. So that's good news. And you also mentioned this week that in terms of other communities in the state, our number of confirmed cases is actually relatively low compared to some similar sized cities.
Absolutely. We're extremely blessed with those numbers. We don't wish those numbers on the other communities, the Brocktons, the Chelseas, the Lawrences. They may have just gotten hit with it earlier. They may have just been in a bad way. But our numbers are significantly lower than that. We're probably tied with our sister city, New Bedford, right at the bottom of this thing. There's 40. They ranked the top 40 communities in Massachusetts, and we were 38. We have 165, and when you contrast that with Brockton, which is over 1,100, you realize the extent of the battle we could be in if we hadn't caught a break here on this virus.
You always talk about you want to be number one. This is one you don't want to be number one in. You want to be at the bottom of that list, and so far the city's doing well.
I'd like to be number 365. That's how many communities
absolutely. There's been a lot of talk, Mayor, about our long-term care facilities, our nursing homes and the like. In a lot of communities, that's where a lot of these cases have been coming from. What's been the city's tact in terms of following up with those long-term care facilities and making sure that those people remain safe?
Well, what we do is we call these the different long-term care facilities regularly. I was on the phone this morning with one of our biggest providers in the city. The people in the office, we called almost all the nursing homes yesterday, for example, and asked them how they were fixed for supplies. We got another batch of hand sanitizer yesterday, and on my way home, I swung by Catholic Memorial Home and a couple of the others to drop off some hand sanitizer, and we're going to do whatever we can to help them. We stay on them, we monitor them, we ask them what we can do to support them and how their residents are doing, and that's the best we can hope for. If they have an issue or there's a problem, they got to let us know right away, and they're all cooperating fully with us. Now that's just the way it is. But somebody from the outside could bring the virus into one of those places at any time. So we're trying to do everything prudent with gloves and masks and keep those residents safe, because that is obviously the number one high risk group. I think anybody 60 and up is in the targeted area. The others, obviously, they can get it, but that's the group that seems like the predominant number of cases are in.
This week, you also had the opportunity to update the city council. They met for the first time, some of them in person, some of them remotely. And I want to go back to your meetings every week with the hospitals. You had some numbers, I believe, almost 3,400 at the time, 3,400 tests from between primary care, Charlton, and St. Anne's. And you broke it down well. How often are you getting those numbers from the hospitals?
Probably 2-3 times a week. We have conference calls regularly. What we do, Keith, is we bring in all our public safety officials, the chief police, fire, EMS, and we meet with St. Anne's and Charlton or South Coast. It's a regional hospital, obviously, and we talk about where we are, numbers wise, where we are bed wise, how's the testing going. We also get numbers from Primary Care, which does their drive-through testing center over at their facility. And we try to get a handle on where we are right now. I would say we're going along in a good place. It's just any minute, things could go off the rails. We just got to stay on the message we have now and on the great work that those people are doing. I mean, I can't say enough about our first responders and our medical staff and our crew. These people are just absolutely grinding, and they are, and that's what we need in a battle like this. And they're doing everything they can do to try to keep a handle on this. And we go along day to day, and that's what we're doing.
I always bring up every week, and one of the things you also brought up with the council is the fact that our local public safety officials are still doing their job, police, fire, EMT, and that it looks like, again, I like to couch it this way, people are pretty much behaving in terms of calls coming into police and fire. They seem to be normal at this point.
Right, normal to down a little bit. What's happening is people are staying in, so that's obviously creating a lot less traffic, a lot less pull on our public safety officials. They're still out there patrolling. They're doing everything they can do. There's been a push lately, which we may get to that point for a curfew, but I don't know if you were over there at the groundbreaking for those two alternative COVID facilities in New Bedford. But I think John Mitchell, the mayor of New Bedford, summed it up pretty good when we were talking. He said, Paul, I'm going to have my police riding around all night, stopping cars because people are past the curfew, exposing them to God knows what. He said, we're going to compact or compress the hours people can shop and get the goods they need. People do like going out at 9 o'clock at night when it's a little quieter. They feel a little safer, grabbing some things at the grocery store, and hopefully getting home. I think a curfew, obviously if everybody was fully stocked and everybody never left the house, that might be one thing, but I still think people need to get around and get some of their supplies. And plus we have all of our nursing homes and our hospitals running second shifts. We don't want to be pulling over a nurse on her way to work. If you're going to stop cars, you got to stop cars. And I just want to make sure people understand that when we go to those kind of measures, it's going to be hopefully a last resort. We would love it if everybody just stayed in on their own and voluntarily helped us. But when you go to things like that, there's going to be a lot more contact between our public safety officials and the community. And that might not always end well, especially if someone's carrying the virus.
Have there been any of our public safety personnel that have been tested positive as far as you know, Mayor?
The ones I have heard about, and I did say that with the two firemen, I heard both were doing extremely well. Minor symptoms. Let's hope it stays that way. Those are the only two I have, and we had a dispatcher who I got to believe is almost clear now to come back to work. I know you gave the number a little bit earlier. I think I looked at the board this morning. I think we're at 69 people of our 165 positives have cleared to return to work. So that's obviously, like you said, Keith, a good thing.
Yeah. Next phases, people are already talking, President Trump talking about reopening the country and getting people back to work. I know a lot of what happens in Fall River is going to be dictated by Governor Baker. I know he's going to be making some announcements fairly soon about what will happen next. last week when we talked, you talked about how the hospitals were anticipating that between the 15th and 17th, which we're in right now, would be sort of peak moments. And that appears to be the case statewide, as I believe yesterday we had over 150 deaths in Massachusetts. What kind of things are you hearing from the governor's office? Are you hearing anything at all in terms of what may happen in terms of next steps, or whether, closures will continue into the month of May?
No, I mean, obviously they're going to continue right now until May 4th. Whether it extends past that is the question. I don't believe there's any clarity on that issue yet. I think we have to play this out and see how it goes. We have another couple of weeks here. I'm hoping that this is the peak, because the peak gets us one day closer to being out the other side of this thing. I just don't know. I mean, as far as openings, I know there's starting to become a push for that because of the financial impact on the state and on cities like Fall River. But at the same time, we don't want to do that too early, or it's going to really, really blow up in our face.
Yeah. All right, Mayor Coogan, I appreciate your time. Hopefully we'll talk again next week, and please remain safe, and we'll talk soon. Thank you.
You too, Keith. Thank you.
All right. I want to thank Mayor Coogan for joining us again today with his weekly update on the city's handling of COVID-19 in Fall River. Again, we remind you to check out our website, frmedia.org, for all the latest information from FRCmedia. You can find out the latest on COVID-19, as well as some other information, including some of our programs on our cable channel, Channel 95, and some of our programs online. So until next time, I'm Keith Tebow. Thank you for joining us, and we'll talk again soon.